7:30 is Miotto Monday, as I mentioned earlier. Surgery days, Mondays are long days, but it's always nice to talk a little bit about plastic surgery, maybe answer a few questions that you may have. Today I suggested that we would talk about surgery for the breast with implants, but also wound healing would be very important because we have so many patients that come to me. They're afraid of scars. Yes, scars are a big deal. It can be a big deal. But we have so many things we do as plastic surgeons to improve scars and to make the results look as the best we can. It's not always possible, but most of the time it's really possible. Because there are some principles of making the surgery happen in a way that will relieve the tension at the incision line, and that will make things look very good. Let's see who's here. Hi, Annie. Hi, Josiana. Kimberly. Caroline. Happy Monday to all of you. If you have questions, just comment here. I'll be looking at comments, and that's a wonderful thing for us to chat. I replied to some questions this morning about breast implants. Today we did a patient in her 40s, just normal breast augmentation with silicone breast implants. When we do that, usually the number one incision I use is the incision under the breast. Why? Because that is the incision with least amount of tension we have, and it's hidden under the breast. Boa noite, Annie. Boa noite. We speak Portuguese a little bit here too, for the ones that speak Portuguese, of course. But anyways, that incision is the one that with the least amount of tension, so usually heals really, really well, because we're not removing skin. We are not also doing through the areola, where it has a lot of tension potentially there. So that is a beautiful skin incision to heal nicely, and we can do in a very small way. And if the implant is small, it looks even better, because the larger the implant is, the bigger we need to make the incision in the IMF, which is the inframammary fold. Now, when patients have to have skin removed with the breast augmentation, that is called a mastopexy, or a breast lift with the breast augmentation. Then we need to put other scars. We're usually around the areola and a straight scar here, which is called the vertical. And that is to take skin all the way around of the breast. Those incisions sometimes can heal with a little bit more visibility. But now we have a device that we have been talking about. Yesterday I posted about Brijjit, and you have seen me use Brijjit's a lot here. Hi, Brijjit. Brijjit's there. They just joined our live. Hi. So Brijjit is a company that is dedicated to improving the healing quality, and just by chance it was created by my husband, Dr. Eaves, who is a plastic surgeon as well. We met through plastic surgery. I posted that yesterday. But Brijjit has so many other, like probably almost 300 surgeons using Brijjit now, about 8,000 to 10,000 patients treated, because it is a very cool and simple device to relieve the tension. And that's why we have better scars. We have loss of openings in the wounds. Dr. Sozer also joined. Hello. So when we have a mastopexy, for example, and we have the vertical scar, which is the one with the most tension, we would like to have, we always wanted something to offload the tension of that incision. And we didn't have anything that was very effective without causing problems before Brijjit. That's why I use it a lot. Yes, I have to pay for it as well, because I'm not an employee of the company. I don't work for Brijjit, but I love the device, as well as many other surgeons that have been using the device. And today I have my special guest. I bribed him to be here today. We just opened an account for him yesterday. He was Monty, Dr. Monty Eaves, also known as the Brijjit founder, who is also my husband and a plastic surgeon. So he's joining us today to answer a few questions about Brijjit, because everybody asks me when they come to the office saying, oh, those little clips that you guys have, and your husband used to also do surgeries, but now he's just with Brijjit, right? I said, yes, he is a very accomplished plastic surgeon, including has been president of our Aesthetic Society, of the American Board, the director of the American Board of Plastic Surgery. But he really believes Brijjit can change the way things heal. So he has been dedicating his life now to that. So Monty, we just opened his account. I'm going to leave it right here, which is at Dr. Monty Eaves. And then if you have questions about Brijjit, you can actually send that to him. I just wrote down here. His account is brand new. So I'm introducing him to this platform because he can help a lot of people understand about the product, and he is the expert on this. I just am a very good customer and a very happy customer. So Monty, why did you start Brijjit in the first place?
Well, as you know, and I know, and plastic surgeons everywhere know, and actually surgeons of all types know, we often leave the operating room really feeling good. We did our very best. We did everything we could to make the procedure look beautiful and to close the wound in a way that the scar would heal with the absolute best outcome. And it's really frustrating sometimes because it's out of our control. Once we leave the operating room, it's out of our control. And for our patients, it's out of their control too. And so we wanted to do something that would allow us to offload the tension immediately at the moment we're closing the wound, but then maintain that tension reduction over time. There's a lot of science now that shows that tension actually not only can lead to opening wounds or wounds that are at risk of dehiscence and then maybe even secondary infection, but we also know that over time, that tension on the wound stimulates a bunch of biological activities that can make the scar worse, can make them thicker, wider, uglier.
Oi, Fabio. Sorry.
Yeah.
So, yes, offloading the tension is critical, but why is Brijjit different than what is already in the market? What makes it so special? I know, but I want you to explain why.
Well, I think part of it is the simplicity. It's very easy to apply. It's actually easier to learn and to do than to place sutures. Because it's segmental, because there are multiple ones will be put, we can also have the kind of alignment and control that we want. So the incision has that precision that we work so hard to do when we close. So that's really important. There's a lot of in the way that it acts. It opens up and then it actually has this dual arc of rotation. So it pulls and gathers the tissue together in a way that projects the tension offloading actually underneath the surface. So those are the things that make a difference.
Yeah. Patients are sometimes like thinking, does it hurt to put on? No, it's just an adhesive. So the adhesive is actually the coolest part, because everything about Brijjit was developed like by piece, all made in the US, and the adhesive is non-blistering, hypoallergenic. So we can use in all skin types, even very sensitive patients, and patients can shower. I tell my patients all the time, you can shower with Brijjit's on, and the blood, whatever it's underneath, will wash off, because the material that Brijjit is made makes the blood just slip off. It does not adhere to it, and that is the most beautiful thing. Usually, like what other surgeons are seeing, how long does it stay in place usually after we put it on?
So the length of adherence really depends on the body area. So for instance, in the breast, it can often stay on 2-3 weeks, maybe even a little bit more. In the arms, we do a brachioplasty, we do an arm lift and cut here. That is one of the hardest scars because it looks beautiful at a week.
Yes.
And then 6 weeks later, it's a thick, ropey scar way too often. So not only will it stick there for a while, but because it doesn't hurt at all to apply, we can reapply as needed to keep that tension off the wound for Brijjit scar therapy.
Yes. What I've seen is that a lot of colleague plastic surgeons are using it. We have that available in the US and Canada, right?
Soon to be Canada.
Soon to be Canada. But I have a lot of surgeons from Brazil and patients like, oh, bring it to Brazil, please. But it's not available yet. But it's available in the US, and we have about 300 surgeons that have used Brijjit's.
Right.
Yes.
And growing.
And growing. So when I talk about a mastopexy, this incision here is usually the incision that we put Brijjit's on, because Brijjit's work really well for flat leveled incisions. It doesn't work well in creases by the way the device folds in and reduce the tension. So arm lifts, it's amazing. Tummy tucks, we can do vertical breast, thigh lifts. I don't do thigh lifts that much because I focus on the face and breast. But that is a great option for patients that want to have an extra level of healing that is supported by it. So we always keep the bridges until they fall off, which is usually 3 weeks after surgery, but we reapply the bridges as a scar treatment after they fall off for many patients. And that is a huge advantage of that, because we can keep offloading tension. If there is by any chance any wound opening, a little incision opening, if the patient has an issue, we can just close that back on with Brijjit. So to me, it has been life-changing. It's not because he's my husband, but it was a brilliant solution, and I fully support his his endeavors on this, because it will transform potentially the way we heal incisions and we take the tension away from it. So what would be the very exciting thing coming up for Brijjit soon to happen?
So one thing, and this isn't just for plastic surgery, this is something that can have an effect for a lot of incisions on the body. So this is one thing. But really exciting news is we should have publishing very soon 2 very significant articles that really give evidence to what we've been doing. So these should be publishing within the next few weeks and show a very significant reduction in wounds and actually smaller scars at 2, 4, and 8 weeks. So we're really excited about that, and more to come. It's important to say
that is a randomized clinical trial from UT Southwestern. So it was really something designed, and we are so excited about it because we know it works clinically, but we want...
You can see it.
Yeah, you can see it. But, if you have such a proof of like something real helps the scars that way, it's something to be really excited about.
And that's why we wanted to do this type of trial. You put your money where your mouth is, right? If you really believe it works, you put it up there and let it be proven.
Yes.
So we're super excited.
And what about baby Brijjit? I have been waiting for baby Brijjit. Tell me more.
Well, it's been a complicated pregnancy coming out. Just
baby Brijjit. Not mine. It's not mine. I'm not pregnant. It's Brijjit medical baby. Yeah. I'm not.
So we have a new size coming out that's smaller that will allow us to expand use to some other areas. So for instance, in the breast lift, the area around the areola it can sometimes scar poorly, can form hypertrophic thick scars, and we want to be able to help that and other areas in the body. So the new device is called the BP75. We sometimes call it the baby Brijjit. That has been something that we've had to kind of work through changes in manufacturing. Quality control is so important. You want it to work every time, 100 times, 1,000 times in a row. So we're making sure that all of that is validated and out soon.
Yeah, so basically it will be a Brijjit for small incisions. And his hope, since I'm not an employee of the company, but that one day maybe we'll have this available to everybody in pharmacies and places, then people can actually use themselves and reapply. Now it's only available for surgeons and through plastic surgeons or other surgeons that are using through their offices. It is a medical device. It is FDA approved and soon to be confirmed and published by this randomized clinical trial in another cohort study that is very large from very, very good plastic surgeons in the country, showing that it really decreases scars and opening of the wounds after closure. When we have, for example, we are talking about breast implants and a mastopexy. When we cut the skin around the breast, we always are afraid that this incision can open, especially if there is an implant underneath, because that is a big problem. The implant needs to be removed. So with Brijjit, to me, it's just like such a peace of mind, and I just see that even if I have something there, I'll put that on, and that will decrease the tension. But if I have a lot of friends, plastic surgeons here, you just need to follow the instructions specifically to apply Brijjit, because then it will stay and it will work the way we intend to be. You need to degrease the skin with alcohol, we need to put it on, and we need to squeeze and release the applicator in a certain way, and then it's flawless. It's flawless. It stays there the way we want to stay, and it helps our patients heal. Every time I do an incision in any high tension area, even in the office, like someone wants a bump removed from a shoulder or from the arm or whatever, I do my suturing like I used to do. And instead of just putting a Band-Aid on or covering, I put bridges to just offload the tension as well. So it's one of the ways I make sure that I'm having some control over the incision, right?
Absolutely. One little trick, when people decrease, those of you out there that are using, you want to rub a little bit, and that exfoliates, right? So that's what we do when we do skincare and everything. We often exfoliate, and we remove those outer dead skin layers, and it will stick better.
Yeah.
The other, I think, little kind of interesting thing, you talked about how special the adhesive is.
Mm-hmm.
We've been very fortunate. To date, we have not had an official report of an allergic reaction. At some point, anything will have at least a little bit. But it's proven to be not only very reliable, but very non-reactionary. So actually, even people that have allergic reaction to Band-Aids or to tape dressings or things like that, they can often be able to tolerate these well. And if that's you and your surgeon wants to use Brijjit, they can actually put a little trial one on a little bit ahead of time and just make sure there's no reaction, then you're good to go.
Yeah. So just re-emphasizing, this is for surgeons. Patients the Brijjit is not sold in pharmacies or to patients, but there are so many surgeons using out there. So ask your surgeon if they use Brijjit or they heard of Brijjit, because it really will make a difference for several incisions. There are very high risk of opening and having complications.
And for better scars.
Yeah, of course.
Yeah.
Offload the tension. But the main point is scars are complex. We as humans, we have been healing the same way for so many millions of years. We heal the same way. And what we are trying to do is to control the healing. And we have been doing that with so many different things. But now we actually have something that really takes the tension away, and that is the main culprit of bad scarring and opening and wound opening during surgery. So I just want to thank my special guest. This is the first time we do a live together or anything on Instagram, really, together. And I hope you liked it. If you have questions about Brijjit, about scars, about incisions, just comment here. This live will be recorded, and thank you for watching. Have a good night.